You're welcome back. Let's talk about congenital penile curvature. We call it CODI. It's a condition present at birth. It causes your penis to bend or curve. It becomes more apparent during an erection. It may not require surgical treatment unless it interferes with intercourse or causes other problems. What is congenital penile curvature? Let us go. It is also known as CODI. It's a condition that can affect newborns assigned male at birth. You may notice penile curvature early in your baby's life when you change baby's diaper, but many people don't discover they have CODI until they go through puberty and have an erection. And most congenital penile curvatures are mild and don't require treatment. But in more severe cases, your penis is significantly bent or twisted along the shaft. This can make a person feel self-conscious, cause pain, or affect sexual functions. It could also impact a person's ability to aim their pee in the toilet. In this case, surgery may be necessary. Is a penile curvature normal? No. Some degree of curving up your penis can be normal. In many cases, the penile can curve slightly to the left or to the right when it is erect. Penile curvature can also cause the penis to bend upward or downward. How rare is penile curvature? Study shows that some degree of penile curvature is present in 4 to 10% of male birth. It can occur as its own condition or with other conditions like something we call hypospadia. This is when a person's urethra doesn't stop at the tip of the penis but continues down the shaft of the penis or to the scrotum. Abnormal foreskin, if your foreskin doesn't form as it should, there can be sometimes the skin or other part of your penis that can cause penile curvature or penile torsion. This is when a person's penis appears twisted or torn. Symptoms are causes. What are the symptoms? What are the signs? The main sign of CODI is a curved penis. The bend can range from mild to severe, and the severity of the bend is best seen when a person has an erect penis. It is not when the penis is at rest. CODI typically doesn't cause pain until the penis is erect, and this may affect a person's ability to have sexual intercourse comfortably. It can also cause pain for their sexual partner because of the bend. What does CODI look like? CODI looks like a bend, slight twist, or a curve of your penis, and it's also almost most noticeable during an erection. It often bends down or to the left or to the right, but it can also bend upward. So what are the causes? According to researchers, the researchers don't know the exact cause of congenital penile curvature. However, they believe it has to do with how elastic the tissue in your penis form during fetal development. What are the complications? There are, there are not any medical complications of CODI, but it can affect your person, your sexual health by making intercourse uncomfortable or downright painful for you and your partner. It can also affect you emotionally and can cause distress or issue with your self-esteem, management, and treatment. Treatment is not usually necessary unless the condition interfere with your sexual function or sexual intercourse. In this case, surgery can fix the curvature, and some people may choose to have surgery even if the curvature is mild or small due to how it impacts their self-esteem and confidence. Of course, a parent too or a guardian may decide that surgery is the best option for their child after learning how the curvature may later affect them in life. If your child has this condition, it is best to talk to your healthcare team about what they can recommend, at what age is it treated? Is it going to be treated and all that? Healthcare provider usually recommend surgical treatment during early childhood around age 2. This is due to it being easier for a penis to repair and continue to develop before adulthood. But if a person does not realize that they have CODI until they are older and if it affect their sexual health, surgery is still an option. Just because you're an adult does not mean you cannot have surgery to fix the CODI in your penis. Prevention can be prevented. Can it be prevented? No. Absolutely no. You can't prevent congenital penile curvature, but the prognosis can get worse, can get better. The prognosis does not typically worsen over time. Your healthcare provider can let you know what you can expect if you don't treat a curved penis. So see you in the next video.